for joining the NeedyMeds special topic webinar, Samaritans Suicide Prevention. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started with today's presentation, I want to go over a few tips. If you have any questions throughout the presentation, you can submit them by typing them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we do not have the time to answer your question, we will follow up with you via email. Of course, we encourage you to reach out to Samaritans or NeedyMeds sooner if needed, so I will provide the contact information for both organizations. You can find copies of today's PowerPoint slide decks in the handout section of that control panel. And also, this webinar is being recorded and will be available for viewing on our YouTube channel. So let's get started with what is NeedyMeds. What you're looking at on my screen is our mission statement and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. This is a screenshot of the NeedyMeds homepage. And I always put that up because really our website is the face of our organization. And as you can see, it is full of resources. In particular, you can find healthcare cost savings resources under that Patient Savings tab, and educational resources under the Advocates tab. That's where you can sign up for future webinars or our monthly e-newsletter, Vitals. Also, on the top right-hand corner, you'll see a box around a social media icon. That's our icon to our YouTube channel. I mentioned in the beginning of this presentation that today's webinar is being recorded, and you will be able to find out that again on our YouTube channel. And it's with the social media icons on the top right-hand side. It's the third one from the left. You can also sign up for future webinars in addition to under the Advocates tab on the calendar of events on the bottom right side of our homepage. So, as you saw in our mission statement, an important part of our mission is educating people. And we define that in two ways. One, certainly by letting people know about NeedyMeds and the resources we offer, but also by letting them know about other resources and important healthcare topics, which is why we are so pleased to have a representative from Samaritans with us today. Let me tell you a bit about Samaritans. Samaritans, Inc. is a suicide prevention nonprofit. Their mission is to reduce the incidence of suicide by alleviating despair, isolation, distress, and suicidal feelings. In this webinar, you will learn about risk factors and warning signs for suicide, how to talk to someone who may be suicidal, and basic steps to getting a suicidal person help. Now, let me tell you a bit about our guest, Rose Chayette, who will be walking us through all of this information. Rose is the Manager of Community and Education and Outreach, Manager of Community Education and Outreach with Samaritans, Inc. of Boston. In this position, she teaches suicide prevention workshops to youth, adults, and elders throughout the greater Boston area. Prior to this position, Rose spent 2 years answering calls and texts on the Samaritans Helpline. So without further ado, I'm going to pass the mic and the screen to Rose, hopefully seamlessly, so bear with us while we make that transition. And while we do so, I will remind our users that you can submit any questions that you may have, again, into that question section of your GoToWebinar control panel. And with that, Rose, I'm going to go ahead and pass it to you. You may want to move the mic a little bit away from your mouth, Rose. We can hear in between your breaths, so you may want to give yourself a little bit of room. But other than that, we are good to go. And thanks, everybody, for your patience. And I'll pass the mic and the screen to Rose.
Great. Thank you so much, Carla, and really great to be here again. As Carla mentioned, my name is Rose. I'm the Manager for Community Education and Outreach with Samaritans, and we are a suicide prevention organization located in Boston. So just a couple of our objectives for the day. And I just want to mention that this is a pretty heavy topic that we're going to be diving into. And we have a lot of people out there who I'm sure have, might have personal or professional experience perhaps with this topic. And I want to make a note that at the bottom of every single slide is our Samaritans 24-hour helpline. So if at any point during this webinar, if this is bringing something up for you or you feel like you need to take a break, please take a break. And if you want to talk to someone, we are there by phone and by text. Just really want to encourage people to take care of themselves if this is bringing something up for you that's difficult. And we're going to be sort of focusing on how do we support those at risk for suicide, the people around us, maybe it's family, friends, colleagues, really anybody that we're coming across in life who we might be concerned about. So I want to share a little bit more about our nationwide resource, which is our 24-hour helpline. And I mentioned this is available by calling and by texting. And this is a confidential, anonymous, and free resource. Something I want to note is if anybody reaches out to us, while the person answering the phone with the text will share their name, as the person reaching out, you don't have to share your name. You don't have to share your age, where you live. You don't have to share any identifying information. All we want to hear about and talk to you about is whatever's on your mind, whatever is going on, whatever you're comfortable sharing. And I also want to mention that even though we are a suicide prevention organization, I think sometimes people think that you must be feeling suicidal to utilize a resource like this. And of course, we get phone calls, we get text messages every day from people who are feeling suicidal. We get a lot of people reaching out to us who aren't feeling this way, but they really need to talk about something that's going on. And maybe they're not even in a crisis. Maybe they just need to kind of vent a little bit about something that happened in their day or something that's been going on that's been on their mind. So it's really about reaching out to us because of whatever's going on in life. We are always there to talk, to listen, to show that empathy and that compassion. And I do want to mention a couple of things that we do when we are talking to someone who's feeling suicidal, because I think we do some things that sometimes go against what we might naturally want to say to somebody who's feeling this way. So for example, if I'm talking to someone who's feeling suicidal, I'm not going to say to them, you have so much to live for. And I'm not going to say that because there's a really good chance they are not feeling that way at all. And I don't want to kind of put this thing onto them if that's not actually how they're feeling on the inside. I'm also not going to say to somebody, think about your friends or think about your family, because maybe they are thinking about all of these people around them, yet they're feeling like a burden, or they're feeling like everybody else is just better off without me. So all we do, and what we're going to be talking about today that a lot of people really need, is non-judgmental, compassionate, empathetic listening. And as you know, Carla mentioned, I have experience answering our helpline for about 2 years. And in my experience doing that, even talking to someone who really was at a high risk for suicide, who really was saying they were going to do this, today, tonight, tomorrow, even just giving them a little bit of space of that compassion, not judging how they're feeling, not making them feel like something's wrong with them, a lot of them feel better and even feel safer and able to make it through their night, their day, their week, sort of whatever time frame they have been speaking about. We have a couple of other resources that are more local to the Boston and greater Boston area. Our helpline is available all throughout the country. However, our local Massachusetts resources, our workshops, our grief support resource for people who have lost someone to suicide, these are really located more in the Boston and greater Boston area. But certainly if you are located here in Massachusetts and want to learn more about perhaps ways we could support you or somebody that, wherever you work, definitely go to our website to learn more about these more local resources. I want to share a couple of quick statistics, facts, and figures about suicide. And the number there in the top left-hand corner, this potentially is not actually accurate to how many suicides are happening in the United States, because a lot of times a suicide takes place, but maybe it's not reported as a suicide. So, for example, a drug overdose, it could be a suicide, but it might be reported in a different way, or even possibly a car accident that was in fact a suicide, but wasn't reported as such. So I just wanted to mention that we don't fully know the actual number. However, we do know that numbers have been steadily rising. And I want to mention that middle-aged males are the population, particularly white males, that are dying by suicide the most, with elders a close second. And women actually attempt suicide more than men. You can see in the bottom right-hand corner there, yet men die by suicide at much higher numbers. And there's no sort of one reason that points to this. There are a number of factors, but one of the biggest factors to mention is access to lethal means. And men tend to use more lethal means, women not as much. So, in fact, having access to a lethal mean like a firearm could put somebody who was already struggling at a higher risk for suicide. So if we can remove lethal means, remove firearms, put a fence up on a bridge, something like this, these are actually protective factors we can put in place that can help somebody who might be struggling. And I know that we have people right now calling in from all over the country. So I did want to just share sort of what this looks like throughout the United States. The darker color of the state has the higher number of suicides. And I mentioned before, access to firearms, that contributes to this. Isolation, lack of access to, even perhaps a hospital or some type of resource. So again, we can't blame one single factor that might make more people dying by suicide in one state versus others, but there's a number of things we can think about that might be contributing to this. I want to just do a quick true or false. So this first one says, talking about suicide will cause someone to consider suicide. And this is false. And I think that this is certainly a myth that I hear about a lot in my work. And I do think the culture is changing a bit, but there's really actually no proof out there saying that if you talk about suicide the way we're talking about it right now, if you ask somebody directly if they're feeling suicidal, there's no proof to show that that actually puts the idea into anyone's head. This is actually a way to prevent suicide, talking about it more, giving somebody an opportunity to share what's been going through their head, that it's okay to struggle. On our Samaritans Helpline, we ask every caller, every texter, if they are feeling suicidal. And a lot of people express to us a huge sense of relief when they are asked the question directly, because it's likely something that they've been thinking about and have been holding inside and have been so afraid of the judgment that will be placed on them by people around them if they're honest about this. But sort of opening up that conversation, it can really be almost like a weight has been lifted from somebody's shoulders to be asked the question directly. So I don't anticipate that anybody will leave this webinar today feeling 100% confident or comfortable talking about suicide. I don't think that will happen in an hour, but what I just really hope all of you will walk away with this from is sort of knowing that if you're worried about somebody in your personal life, in your professional life, anyone that you know, if you're worried about them, you can talk about suicide. You can, in fact, ask them directly, are they feeling suicidal? And this might actually be a way to really help them. And if they are feeling suicidal, could even be a way to prevent suicide. So I want you to leave here feeling a little bit more empowered to know that it's okay to talk about this. The second one I want to bring up is people who are suicidal usually warn those around them. And this is a pretty tricky one, and we're going to talk more about what these warning signs might be. But generally speaking, this is actually true. But, I also want to say that I have heard of and I know of situations where somebody does die by suicide and nothing seemed different about them, and there were no warning signs, and everything seemed the same. We know that that does happen, but there is some evidence out there to suggest that 70% of the time, it's about 7 in 10 situations, someone who is suicidal is giving off warning signs. They may not be explicit, they may not be too obvious to us, but something is changing. And so we're going to talk more about those in a minute. It's just something I want us all to think about, is sort of being aware of the people around us, knowing what some of these warning signs can be, and then not being afraid to talk to somebody if we're seeing something that seems different from what we usually know about them. It's a sign of weakness to ask someone for help if you're struggling. This is, false, absolutely. It can be so hard to ask for help. It can be so hard to admit that we're struggling. And I always tell people it's a sign of strength to ask for help. It's not a sign of weakness, and something that I think is important for us to try to share and say to the people around us. And people who are depressed or suicidal are just seeking attention. And one of the reasons, this is false, one of the reasons that I felt sort of compelled to put this in here is, as part of my job, I go into middle schools and high schools. I talk to a lot of young people really directly about suicide. And I've heard so many times students share, my parents or adults around me or people around me, they don't believe me. They don't believe that I'm struggling. They think I'm just trying to get attention, or they think that I can snap out of this sadness, this hopelessness that I'm feeling, when it's just not that easy. So that's why I share this, is just directly hearing from young people, particularly young people, although I think a lot of people might deal with this sometimes, but specifically young people saying, I feel like people don't believe me when I share these struggles that I'm going through. I just want to mention some of the complexities of suicide. And to that second bullet point there, suicide is not about wanting to end the life. It's about wanting to end the pain. And I think that's a pretty clear distinction of, maybe there's this person and they really feel like, gosh, I still want to be here. I want to live, but I don't know how I can do that with all of this pain that I'm in, with all of this hopelessness that I'm feeling. And it's never just one thing that causes that leads to a suicide. To the first bullet point there, I sometimes hear stories in the news, and they're incredibly tragic stories, but they basically are saying maybe a boy was getting bullied in school, so then he took his life. And it's kind of presented as a direct cause and effect. And not everybody who gets bullied has thoughts of suicide. This is not a direct cause and effect. It's much more complex than that. And maybe there is, like I have up here, a precipitating event, a really challenging, painful thing that happens in someone's life, but we can't necessarily blame the precipitating event when there's probably more going on below the surface. And I want to sort of talk more about what those things can be that might be going on for someone. And these can be the risk factors here. This list I have up here, this is not inclusive of all of the challenges, struggles, difficulties that a person could deal with in life. Of course, we can think of so many more. But I wanted to just show, some examples of things that can be challenging for a person. And maybe you work with someone, or maybe you know someone, and it's not like they just have maybe trauma, but maybe they also have lack of access to healthcare, behavioral or mental health care. Maybe they are dealing with a substance use disorder, or maybe they had a recent loss. Things can really build up. And like I said with the bullying, it's never just one thing. So maybe we have a person who is dealing with a number of risk factors, whatever they may be. Maybe on top of that, they feel like, I just don't really have support, or I don't know how to cope. I don't know how to deal with this. And perhaps on top of that, they also have a mental illness. And of course, a mental illness does not cause suicide, depression, bipolar disorder, whatever it is. Those things do not cause suicide. But if we have all of these stressors and all of these difficulties piling up on someone's shoulders, and they don't have any coping skills, and they don't feel supported, and perhaps grappling with a mental illness, I don't think it's too hard to sort of imagine and see how somebody might start to think about suicide and how they might start to feel like this is too much on my shoulders that I'm carrying. This is so overwhelming. I can't deal with these things anymore, and I just don't want to be here anymore. And if someone starts to feel like they don't want to be here anymore, like I mentioned before, not always, but it seems like more often than not, we do have warning signs. As you can see, they kind of fall into these three categories. So first off, with verbal, people do sometimes say very outwardly, I'm going to kill myself, or I'm feeling suicidal. People can be very open and honest and explicit about that. Sometimes it might be more subtle. I'm tired of being a burden. Nobody would miss me if I were gone. And I also have up here jokes about suicide. I mean, I hear students make jokes about suicide. I hear adults make jokes about it. I hear elders. I just hear sort of across the board, whether it's a student saying, I failed my math test, I'm going to kill myself, or someone saying, oh, I was stuck in traffic for 2 hours, I just wanted to shoot myself. People make these offhand comments. And I think, for me, if I heard a student say, oh, I failed the math test, I'm going to kill myself, I think my first instinct is probably, well, they're not really going to do that. They're just overwhelmed. They're stressed out. They're upset about this math test. But something that I want us all to think about is just that sometimes people do make joking, offhand comments about death or suicide, and they actually are struggling. And in a sense, they're trying to test the people around them to see, is anybody really listening to me? Does anybody really care? So I just really encourage all of you, the next time you hear, like if you hear a joke or a comment, or even something on Facebook, on social media, in an email, in a text, whatever it may be, check in with the person. Say to them, I heard what you said, or I saw what you wrote. And when I hear comments about death, about suicide, I take it pretty seriously. And so I do want to check in with you to see, are you okay? Is this something that you've been thinking about? That can be awkward and uncomfortable to do, but I don't think it hurts to check in with people, and I would rather feel kind of awkward about a situation. I would honestly I would rather offend somebody by inquiring into this than think about it later on and be like, gosh, they made that comment. I wonder if they're really feeling this way. So just to help us think about checking in with people, because maybe they're not actually joking. We've got some physical warning signs, and these are all changes. I have hygiene up here. Maybe there's a person, and as long as you have known them, they don't have great hygiene. For some people, that is kind of their norm, and maybe we should be worried about this person for whatever reason. But I'm more concerned in this context about the person who maybe really had good hygiene and took care of themselves and cared about their appearance and how they were presenting themselves. And now after a couple of weeks, a month, 2 months, something like this, I'm starting to see it falter. It's kind of falling apart. They're not taking care of themselves. Changes in sleep. And obviously a lot more of these are behavioral, declining school or work performance, withdrawal, loss of interest. And I really want to highlight this one in the bottom left-hand corner here, a sudden mood lift after a down period. And this is a really tricky one. What this basically means is if there is a person who, maybe often seems down, operates at kind of a low level, and then there's a spike, and they seem pretty happy, and they seem like they're doing better. This could mean so many different things, but when it comes to suicide and the warning signs, it could mean that they've found a way out of their pain. They've maybe thought about a plan to end their life. They're seeing the end to that pain, So they're actually presenting as better because they see that endpoint. This could also mean that somebody is getting help and they are doing better. It could even be related to medications, antidepressants that somebody might be on. So this is a very tricky one. It's just one I want to mention because I hear about this being really common, and it's just not quite as intuitive as some of these other warning signs are. So there are other examples of warning signs. I think these are some of the biggest ones to be aware of. And again, it's not just enough to know about what some of these can be. We have to know them, and then we have to kind of be comfortable approaching someone and saying what we're seeing, whatever it could be. Maybe, gosh, you seem a lot more tired than usual, like more tired than what I know about you. Or I know you used to go to church every Sunday. I used to see you at church and I haven't seen you in weeks. Has something been going on? Whatever the change from the norm is that you're seeing, putting it out there, opening up that conversation. If someone really is struggling, they might feel good that you notice this change. And depending on what you hear in the conversation, you might then end up wanting to dive into a conversation about suicide, but we're going to get there in a couple of minutes. So with this slide up here, it's just sort of looking at how events over time can build up in an individual to the point of maybe they actually feel like they're drowning. So, we have an example of a person here, a 60-year-old woman, and as I'm going to bring up some of these stressors that have happened in her life, and you can see sort of the water is starting to rise. So age 30, mother dies. Age 35, starts a high stress job. Age 40, gets a divorce. 45, diagnosed with depression. Breaks her hip at 50. Addicted to painkillers at 55. And maybe starts to have suicidal thoughts at age 60. And, some of these things up here could be related to one another, some of these events in this woman's life. And maybe things could have been done along the way to help prevent the other risk factors that are building here. And this is just for us to think about, like, what we could be missing when we're interacting with people in our life. We may see that someone is struggling in some way, or maybe we know one thing that a person is dealing with, but we may not be aware of the personal story behind the events or how much is really filling up on the person's plate. And obviously, everybody handles situations differently, but it's so important for us to realize that, we may think that one thing that a person is dealing with is just small and it's no big deal, and that they can get through it, but they may actually be feeling like they're drowning because of all of these things that have been building. So we can't see what people are carrying around. We can't see a depression diagnosis. We can't see the high stress job. We can't see the addiction. These are things on the inside, these sort of invisible stressors that we carry around. We can't see it. So we just have to do our best to not judge people or make assumptions about them, since we just simply don't know sort of what people are carrying around and if they might feel like they're drowning based on everything that they have been dealing with in life. And just to sort of continue on with this discussion of all of the things people can be carrying and dealing with, we all are dealing with different things in life, and we all cope with those stressors and difficulties and risk factors in different ways. And, when I'm doing my workshops face-to-face with people, I always have them take a minute and write down maybe 3 to 5 things that they do themselves to cope with stress. And so, maybe not right now, but I encourage everyone listening to take a minute, maybe once we're off the webinar, to just jot down the things that help you, because maybe everyone out there, maybe some of you or all of you out there are supporting people every day, maybe professionally, maybe personally, probably both if I have to make an assumption. And it's so important to know what we can do to take care of ourselves, to be our best selves, but also we can't take care of other people if we can't take care of ourselves. So just trying to think about what we can do to be our best selves, to take care of ourselves and then help the people around us. One thing I want to mention too, just in terms of coping and resiliency, I definitely something that comes up sometimes when I'm talking to various groups is sometimes people don't know how to cope. I've definitely had experiences talking to people on our helpline who were really asking me to fix their problems, or telling me, I don't know what to do. What can I do? And as the person listening to that, I don't know the answer. What works for me to say to them is to say, hey, I know what helps me when I'm having a really difficult time, but I don't really know what's going to help you. But let's talk about that some more. And maybe I can share some coping skills that I know work for other people to help them to relieve their stress and deal. And these may not help you, but let me share a couple and kind of see what you think. And it can be used as a time to not say to this person, oh, go for a run, or, oh, you should go meditate, or you should call a friend. It's just saying, hey, giving a few examples of things like sort of healthier coping skills that work for some people, and then asking them, what do you think? Do you want to try one of these for maybe a week and see if you feel better? And if you don't, that's fine. Come back to me and we'll talk some more. We'll brainstorm some more. And then we can always be building up our resiliency, always be building up our coping skills. The things that worked for me 5 years ago might not work anymore, and I have to sort of reevaluate, what helps me, so we can do this for ourselves and do it for the people around us that we might be supporting. So we're going to talk about right now more about how we can help people. And it could be that we have someone in our lives and we know those risk factors in their life, or we know that the water has been rising, and things are getting more and more overwhelming. Or maybe we don't know any of that, but maybe we've seen or heard some warning signs. Maybe we just have one of those nervous gut feelings inside and we want to talk to somebody. And what I'm going to share is sort of some of the things that we do on our helpline with Samaritans to really support people. And you can perhaps do some of these things too. So the first thing is crucial, actually listening. And it's important to show with our bodies that we are listening. So making eye contact, putting away distractions like a phone or anything else that's in front of us that could be a distraction, nodding our heads, not crossing our arms, like having a really open posture, because, even though I do think that crossing my arms is very comfortable and I do it all the time, or it's cold, I also don't want to be talking. I don't want to be speaking to someone and have them look at me with my crossed arms and think, gosh, is she mad? Is she bored? Is she judging me? Just trying to have that really open posture is important. And then some of these don'ts we have here. So with the first one, don't talk about yourself or reflect on your own experiences. And I do want to put a little star next to this one, because I do think that there are times where it's really valuable to say to someone, hey, I don't know what it's like to be in your shoes and be having this experience or be in this situation, but I've been through something a little similar. Would it be helpful to hear how I dealt with it? That can really build connection. But I think that more often than not, we kind of want to talk about ourselves, and that's normal, but that can get so frustrating. If I'm talking to someone and they're saying to me, oh, I completely understand, I really get it. Well, maybe they don't get it. Maybe they actually truly don't understand and are just assuming that they get it based on the little bit that they know. So this is really hard to not talk about ourselves, but I just sort of recommend doing our best to kind of give somebody a little bit more sort of space in a way to just share what they're going through and not bring ourselves into it as quickly, or perhaps not even at all. And the second one here, I think, is the hardest thing to do, to not give advice, to not try to solve problems. I struggle with this. Everyone struggles with this. It's just so natural. We hear a problem. Of course we want to fix the problem. Of course we want this person to not be in pain, to not be struggling. But, there are some problematic things that can happen when we start to give advice to people. First of all, I might give somebody advice, but they've already tried this. I had no idea, but they've already tried it. It didn't work. They might feel worse. Also, I might think that I give great advice, but what works for me might not work for somebody else, and my advice could backfire. This person could come back to me and say, well, you told me to do X, Y, and Z. Now look at this mess. That some of that blame might be on me. At the core of it, a lot of people just really don't want to be fixing their problems in that moment. What they actually want is for somebody to listen. And the second we start giving advice, we stop listening. So again, this is a really hard one, but I just sort of encourage everyone, the next time somebody comes to you with a problem, if the gears start turning in your brain of, oh, I know what they should do, I'm going to give advice, I'm going to solve this, I would hold off. At least at the start, I would hold off and just listen. And they might feel so much better that you listened rather than starting to give all of this advice. And I think it's okay to ask permission to give advice. Hey, what do you think would help you most right now? Do you want to try to fix this problem? Because I do have an idea of something you could do. I'm not sure if it's going to work, but I could give you some advice. Or do you just want to vent? Just want to kind of get this off your chest. And, you could present those options. And if they say, yeah, I'm so tired of dealing with this, please, what do you think I should do? Share the advice. If they say, it's too overwhelming to try to fix right now, I just had to vent, I would really respect that and move on. If we're listening to somebody, we also have to ask them open-ended questions. And these are really questions that can't simply be answered with a yes or a no. Questions that start with what, with how, how did this make you feel, or what feels like the hardest thing for you in this moment? Tell me more. And even like validations are really, really good to do. I can't imagine how that must have felt. This is such an unfair situation that you're in. Just sort of letting them lead the conversation and asking those sort of natural follow-up questions. We do try to avoid why questions, though, at Samaritans, because when we ask questions with why are you feeling this way? Why did you do that? It can come off a little bit judgmental. And also, if I'm asking a question with why, I'm looking for an answer. And there's a really good chance that they actually don't have an answer at all. So that's why we try to avoid the why questions, use the what's, the how's, the when's, things like this. We also try to follow this 80-20 rule at Samaritans that I like to share. Basically, it means the person reaching out to us, they're going to get sort of 80% of the talking time, the talking space. And as me on the other end of the line, I'm going to give 20%. Now, this is, of course, a magical ratio, I guess, that doesn't always happen. Of course, there are times where I'm speaking to someone and they are so quiet and I have to give way more than 20% to get anything out of them. Or the flip side is they are talking so much, I can't get any words in. So I just like to share this as sort of a nice idea of trying to give people a little bit more space to talk, to share, because we don't always get that. A lot of people don't always get that. At the end of the day, we don't always know what to say. I certainly find myself in situations sometimes still where I find myself at a loss for words. Either my mind has just kind of gone blank, or the things that I'm hearing are so upsetting and difficult that I just am sort of at a loss. And it's okay to not know what to say. I think it's okay to say to someone, I don't even know what to say right now, but I'm so glad that we're talking, or I'm so glad that you told me. Tell me more about this. I'm at a loss for words, but what a brave thing to share. These are compassionate things to say, and that can go so far. That can feel so nice. Even if we're at a loss for words, that compassion, they're going to feel that, and they're going to feel that sincerity. So let me just bring these up here. So if you are speaking to someone, maybe you are hearing a lot of helplessness, hopelessness. Maybe you've heard something that really sounds suicidal, or maybe it's just kind of a feeling that you're getting based on the struggles that they're sharing and the words that they're saying. So if I'm going to ask somebody directly if they're feeling suicidal, I might first say thank you to them. Like, thank you so much for opening up to me. Thank you for sharing what you've shared. I can see how much pain you're in. I can see how much you're struggling. And I do want to ask you, have things been so bad lately that you've thought about suicide, or have you been having thoughts of suicide? I have a few examples up here, and not everybody likes using the word suicide, and that's fine. I think that's understandable. It is sort of I've heard people describe it as harsh, maybe even clinical, and so I think there are other ways to ask the question. The key is just to find a way that is asking the question very directly. We can ask someone, are you having thoughts of harming or hurting yourself? But the issue with asking it that way is thoughts of harm, thoughts of hurting oneself, that might be totally different than suicide. And we're really trying to gauge where someone is at with suicide. And that's why it's important to ask it very directly. If they say no, no, I haven't been feeling that way, of course, we're going to feel a huge sense of relief. We're going to be like, oh my goodness, I'm so glad to hear that you're not feeling this way. But despite that relief that we might feel, we actually don't want to express that to the person. We don't want to say, I'm so relieved to hear that. I'm so relieved to hear that you're not feeling suicidal, because first of all, they could be lying. We can't control people's answers, and they could really be feeling suicidal, but they told us no. And now that we've said, I'm so glad you're not feeling this way, they might really sense some stigma, some judgment, and they may not feel very comfortable opening up to us going forward. So if you ask the question and they say no, I would just respond with a thank you. Thank you for telling me that. And let's talk some more. I want to hear more about what's been going on, or just asking a follow-up question based on whatever you were previously talking about. So I have a lot of information on this slide, which I acknowledge that it's a lot. And I always do want to share those questions that are in italics here of what you could do if they say yes, they are feeling suicidal. Now, I want to say these are the types of questions that we ask on our helpline. And again, you may not feel comfortable or ready to do this, but I just want to help everybody understand what you can say, what you can ask, because by asking these questions here, it can help us to determine sort of where on the spectrum somebody is. Are they at one side having thoughts of suicide, but they haven't thought about a plan at all? It has crossed their minds. Or are they all the way at the other end of the spectrum and they have the thoughts of suicide, they know how they would do it, they have access to the means, and they have a time frame? Those are two pretty different places to be. So by asking these questions in the italics here, we can gauge where someone is at. So if they say, yes, I have been feeling suicidal, asking, have you thought about how you might do this? And then finding out, do you have access to that? And then finding out, if you were to take your life, have you thought about when you might do this? And it's sort of all of those questions, the boxes are checked and they have an immediate time frame. For Samaritans, we define immediate as within a 24-hour period. So, that's just our policy. You might have a different idea, or maybe your place of work, or, wherever it is, maybe immediate is defined as something differently. We do within 24 hours. But, this would be someone who's at a really high risk for suicide, and probably some steps need to be taken to support that person and get them some help. And I really believe, professionally or personally, in a lot of professional workplaces and organizations, institutions, there are very strict protocols in place of what to do. But also when it just comes to people in our lives, I really feel that if someone's life is at risk, it's too big of a risk to keep to yourself. Even if that person that you're talking to believes that this is sort of a secret and going to be kept between the two of you, it is such a burden. It's so much to carry on one person's shoulders alone, hearing that someone is dealing with this. I just think it's really important to reach out and get that person some help, whether it's following a protocol, whether it's convening with others, doctors, therapists, social workers, whether it's reaching out to us at Samaritans. We actually have people, oftentimes reach out to us either because they're fine, but they're worried about someone else, looking for some guidance. We have people reach out to us who call us or text us sort of with the person they're worried about, almost to sort of give that person a little bit more support of, hey, I know about this resource. Let's reach out to them together, because it can be scary to reach out to a place like us, but even having the support of someone next to you, people do that sometimes, and I think it's really effective. Reaching out to your own support systems as well. We use something called safety planning, which on our helpline, which basically just means seeing if the person can advocate for themselves and find ways within themselves they feel they might be able to stay safe. So it's saying to somebody, I'm hearing what you're telling me and I'm really worried about you, and I want to see if we can talk about some ways that you might be able to stay safe today or right now or tonight. And then sort of what I said earlier about modeling those coping skills, because sometimes when a person is so deep in a crisis, they can't think clearly. They're so clouded by the pain and the hopelessness. They might not even be able to think about, what are my coping skills? Who else could I reach out to? What could help me in this moment? Very small text at the bottom, you can see there's actually a website you can go to. It's a safety planning template. And I think it's a really good resource, actually. A lot of clinicians use it with patients who experience thoughts of suicide or have been suicidal in the past, but it's a way to talk to people and see if they might be able to find some ways to deal and to cope in those situations. And just in terms of managing reactions, when these situations arise, it's scary, it's hard, and it's normal to feel so anxious and to be freaking out, this is absolutely normal. If I'm speaking to someone though, and they're sharing, maybe they haven't told anybody before that they have had thoughts of suicide, and if they see that I'm kind of creeping up in a way in terms of my anxiety and my fear, this person's probably already at a 10, and then if I'm creeping up to a 10 and kind of meeting them, it is going to make the situation a lot more challenging to deal with. So, even though it's normal to feel really anxious and be really afraid, I think it's important as best we can to kind of show that we're calm, because it will make the situation easier to deal with. But also, to the second point there, give yourself permission to be human. We're going to make mistakes. We're going to say something and then want to hit ourselves in the head and say, why did I ever say that? We're going to make mistakes. We are only human. But you don't need to be the expert or have all of the answers. You are not alone in these situations, whether it's local resources in your community, whether it's reaching out to us, reaching out to other supports. Definitely not dealing with these situations on your own. It's really important to be mindful of our limitations. And what I mean by that is, I truly believe that suicide can be prevented. And I also truly believe that we can't prevent every suicide. And I know that those two statements absolutely contradict each other, but it's just, kind of going back to the idea that we can't control anybody else. We can only control ourselves. And I believe that we can be in a better position to be able to prevent suicide and help somebody if we know how things can build up in someone's life, or what those warning signs can be, and how we can be better listeners, and how we can talk and ask about suicide. I do think we're in a better position to be able to prevent it, but still, at the end of the day, we can only control ourselves, and that's a really hard thing to reckon with, but it is something that I think we do all have to keep in mind. And lastly, self-care. Of course, self-care is really important. A couple of resources up here, and Again, our helpline is available 24 hours a day by phone and by text. We are only available in English currently, as we are a volunteer-based organization. So even though we have hundreds of volunteers, many who speak other languages, because we're volunteers, we can't always guarantee that another language will be available. This is why we're only available in English at the moment. However, the National Suicide Prevention Lifeline, I believe if you dial that number and dial 2, you can speak to somebody in Spanish. So I think that is all. I want to just sort of encourage people to reach out to our helpline. If this has been difficult for you, again, that number is there at the bottom. You can call and you can text. Feel free to reach out to me if you have any follow-up questions. And I'm going to pass it back to Carla.
Rose, thank you so much for that very thorough and useful presentation on such a difficult subject, but a subject that we need to talk about because, as you went over, it affects so many in our country. I will encourage people, and I do already see some questions coming in. And again, you can go ahead and type any questions you may have into that question section of your GoToWebinar control panel. As you've heard me say, I see questions coming in. Don't worry, nobody else can see the question that you're asking. And again, if we don't get the chance to answer your particular question, we will follow up with you via email. But of course, we encourage you to reach out to Samaritans prior if you need to speak with someone sooner. As those questions are coming in, and before I get the chance to present Rose with a bunch of those, I want to remind everybody that we do our best here at NeedyMeds to come up with webinars that we think will be of interest to our users. And what you're looking at on your screen are a few of the upcoming webinars through the end of this month and the beginning of next. And you can sign up for these webinars in a couple of places on our website. You will see a hyperlink for webinars in the center section under that Advocates tab that I pointed out in the beginning of the presentation. And you can also sign up for any of these on the calendar of events, which can be found on the bottom right hand of the NeedyMeds homepage. As I ask Rose those questions that are coming in, I'm going to go ahead and leave up their contact information. And of course, the contact information at the bottom of that screen for NeedyMeds as well. So Rose, one of the questions coming in is just again speaking about how can you tell if someone is actually suicidal or if they're just making a joke or a comment, an offhanded comment. But sort of when you speak to that, I do see a bunch of users a bunch of webinar attendees that are dealing with suicidal, for lack of a better word, comments from really young children. We have somebody that wrote in that says they have a 6-year-old who often, when the 6-year-old is getting frustrated or something bad happens, they're saying things like, you'd be better off without me, or things of that nature. And they want to know, for example, let's see, you'd be better off without me. I wish I was dead. I wish I would go away and never come back to you. As such a little kid, how do you know how to handle that? How do you know if the child is wanting validation, maybe doesn't understand how serious it is what they're saying? So I guess the question really is, how do you talk to really young children about this topic, especially if they're making these really frightening comments?
Yeah, that's a really hard situation to be in. And I have heard from actually very recently a teacher who works with elementary school kids who was hearing, actually the school counselor who works with elementary school kids who, young kids, 6, 7, 8 years old, making statements very much like this. And I know what he said he has done, which has worked for him, is first of all, something that he noticed with this particular situation was that the young person didn't exactly totally understand what they were saying. Like in some ways they did, but then through asking more pointed questions of, what do you mean when you say X, Y, and Z, like some of those things you just said, Carla, like like helping them actually kind of having a very difficult conversation about death, which might feel maybe not appropriate at such a young age. Yet if they're saying these things, maybe we do have to have a real conversation about what death is and what they mean by that, and trying to ask some more pointed questions. I mean, I really feel for you out there if that's something that you're dealing with. And I think that if perhaps you already are working with a clinician or a mental health professional, but I think that this is a lot to be dealing with by yourself. But so, my one recommendation is just to try to ask some more questions of what they really mean. If it sort of feels like they just want attention. I mean, I've heard a lot of people, like parents, say, my teenager says if I take away their phone, they're going to kill themselves. Like they're threatening suicide based on having their phone taken away. Excuse me, or whatever it might be. And, kind of saying, it's hard. Like you don't want to kind of validate that thing they're saying if they're just trying to get attention. Though what I also wonder is if this is the way they're trying to get attention, there's a deeper issue here, like something is going on. So really asking those questions and saying, when I hear things like this is a really serious thing. This is not a joke, and I don't take it as a joke. And every time you say this, we're going to be having a deeper conversation. And every time you say it, maybe we have to bring in some other people to learn more and hear more what's going on. I'm not sure if that's helpful, but sort of what comes to mind.
Thank you so much. Thank you so much, Rose, for that thorough response, and to our audience members for sharing what they're struggling with. Because I always feel like if somebody is asking that question, the chances are somebody else participating in this webinar is struggling with the same or a similar thing. So we're hearing Rose when she says, ask more questions, maybe get a clinician involved, and certainly always reach out personally to the Samaritans Hotline. As Rose has stressed, a lot of people that they're helping aren't necessarily the people who are suffering with these thoughts themselves, but they're calling on behalf of a loved one. And those Samaritans Hotline experts are there just for that. We do have a question coming in from another user asking if there is a difference between Samaritans Hotline and the National Suicide Prevention Hotline.
So that's a great question. So the National Suicide Prevention Lifeline is basically made up of, I don't remember the number, but it's well over 100 crisis centers that sort of all follow their standards and procedures all throughout the country. So we are one of those crisis centers. So if somebody calls the National Suicide Prevention Lifeline number and they have a Massachusetts area code, they are then transferred to us at Samaritans.
Thank you to our attendee for asking that question, and for Rose again for a thorough answer. And I think what I take away from that is that everybody is adhering to such a really high level of training and protocol that they have to follow. Another question coming in: what do you do if the person that seems to need help, and you just know that they need it, and they don't want to get help, or they're resistant to receiving help? Is there anything you can do? And if so, what are those initial steps that you can take?
Yeah, that's a really hard one. And I think that is so common, to be that person who you're like banging your head against the wall, really wanting this person to not be in pain and not be struggling, yet they're so resistant. And, I guess what I would want to ask them is sort of, what's behind the resistance? Is it fear of judgment? Is it fear of being labeled as quote unquote crazy? Is it they don't think anything is wrong and they're okay? I mean, I would want to sort of find out more about sort of where that resistance comes from. I think this is one of those tricky ones that kind of falls into the having to be mindful of our limitations, and that at the end of the day, we really can't control anybody else. When it's like a young person who we have more of an ability to kind of, what's the word? Not control, but like, if it's somebody who's who's young, we might be able to, I hate saying force that
I want
help,
to
but
chime in, and the word that's coming to my mind, excuse the interruption, is influence. Does that work?
yeah. That's I was like searching for the right word. Thanks, Carla. But yeah, like that might be a different situation than perhaps an adult. But saying to somebody, this is unfair that you are going through this, and I don't know if getting treatment or doing whatever it is you're trying to help them get, I don't know if this will help, but there are so many people out there that really have positive experiences with treatment, with getting help, with seeing a therapist, whatever it might be. And for so many people, they are able to get the help they need and live really fulfilling lives, or learn how to manage the depression, or learn how to manage whatever it is that's going on. So maybe also doing it from a perspective of, this is unfair. You don't deserve to be feeling this way. Like, this is such a difficult situation. And then at a certain point that we might have to take a step back and kind of, because again, we can't control anybody else. So it's a tricky one, though.
It is a tricky one, and I think what we keep going back to is what you're saying is, just if you're comfortable just asking more questions. Certainly, again, and I know I keep stressing this, but everything that everybody is asking, they're all really complicated, personal, and painful situations. And we can certainly do the best to answer them. And Rose is doing a great job of providing you guidance, but always reaching out to one of those expert counselors on the hotline so that maybe you can get a little bit deeper into the specifics of the problem. That may allow them to provide a little bit more guidance. Would that make sense, Rose?
Yeah, and I think absolutely, yes.
So, and again, thank you so much to our attendees for participating and asking these questions. We're going to wrap up with one final question. It's sort of an extension of really what we just addressed, which is, someone needs help, but you don't feel comfortable being the person that asks those questions or delves into it a little bit further. So what if someone needs help, but I can't be the person to help them? What do you do?
Yeah, and I think that's really common too. And maybe we feel like we can't help or don't want to help because we don't know how to, or maybe it's too much of a burden on us, like, because maybe there's some people out there that you are always the go-to person to support someone. So whatever the reason is, I think it's okay to say to someone, like, I am really glad that you felt comfortable opening up to me about what's been going on, and I really think you deserve the best help you can get, and I don't know if I can give that. So maybe we can research some resources together, or here is a resource, whatever it may be, a national resource, a local resource, and it's not pawning the person off disrespectfully. It's just saying, you really deserve the best, and at this moment, I'm not sure I can offer that to you. And if it is a situation where it's just like the burden is too much on you, maybe you do have to kind of be like, listen, I'm in a really difficult place in my life, whether it's true or not, but I'm in a difficult place in my life, and I really wish that I could help you right now, but I feel like I can't in this moment. But I don't want you to be out there alone. So again, let's look at some resources together, so that you do have someone you can talk to, or do have someone you can turn to. Just doing it kind of however you want to say it, doing it in a compassionate way, I think.
Thank you very much. And I think that's a really important thing, is being able to usher the person in the right direction, but realize you may not have the capability to provide what's needed at that moment. And really, oftentimes, Rose, her team members, and the people are trained to help people in such a dire situation is really what is needed. And also reminding everyone of what Rose brought up also, which is that remembering that self-care is always important at every stage of this. Making sure that if you are the person, as Rose referred to, as somebody that you seem to be the go-to person for everyone to lean on, do remember that self-care is crucially important. So we do usually keep the question segment relatively brief. So if we did not get the chance to answer your question, and it's a question directed for Samaritans, Rose or a team member will get back to you via email. Of course, it's a question about NeedyMeds. I will get back to you personally, but we do encourage you to reach out to either one of our organizations sooner if you do need assistance right away. With that, I want to thank Rose for taking time out of her day to share her expertise with the NeedyMeds audience. And I want to take time to thank our audience also for joining us and certainly participating in the questions section. Thanks, everybody, and I do hope to see your name pop up in future NeedyMeds webinars. Hoping everybody has a good rest of the day. Take care.